Hello, I'm Glenn W. Hunter, and with me today is Dr. James George of Excel Physical Therapy and Wellness. Today we're going to talk about multiple sclerosis. Dr. George, this is a disease with a lot of attention to it. What compels you today to actually talk about multiple sclerosis?
Multiple sclerosis is a progressive neurological disorder, and many people who are affected by this progressive neurological disorder can end up in losing function. And I'm very much concerned about that, and my heart goes out to them. And if it is diagnosed early and caught early and treated early, those patients can actually maintain their function and slow down their loss of function. So it's all about finding out whether somebody has multiple sclerosis, and that's why we're doing this podcast so that people may know what are the symptoms, what are the things they need to look for. Yeah.
I think and it's important that you picked something like this, particularly today, probably because you are so compassionate with the way you deal with your patients, and this can be a very difficult disease. So I'm glad that you're taking advantage to share a lot of insight and definitely reveal some of that compassionate medicine that is so badly needed and so well recognized in your practice. But to get to the point of this matter, what is happening in the body when multiple sclerosis invades it?
Okay. Multiple sclerosis is, as I said, is a progressive neurological disorder in which the myelin sheath covering of the nerve are actually lost. Basically, the term is called demyelination. So what happens is the nerves are exposed because all the nerves in our body, they have covering. All right. In fact, and the myelinated nerves, they have a covering called myelin sheath. When that is lost, the nerves cannot function and they die basically, and they are not able to send signal from the brain to your body, and send signal from the body to the brain.
Oh. So, on the other hand, what are the potential triggers to develop multiple sclerosis?
Yes, the potential triggers are what the researcher, especially I'm a certified functional medicine practitioner, and research in functional medicine, they have found that potential triggers are gluten sensitivity, lack of vitamin D, heavy metal toxicity, infection, and autoimmune disorders. Autoimmunity is these are the potential triggers they have found for somebody to end up in having MS.
Oh. So, while this is a progressive neurological disease, what medical techniques can slow the progress of multiple sclerosis?
Yes. Before we discuss that, I want to actually say the symptoms of multiple sclerosis, which actually people can look into and be aware of. The main symptoms somebody needs to look for is eye pain, constant eye pain, or which is not getting better, and then numbness and tingling in the arms and legs, or pins and needles in the arms and legs, which is not going away for more than after 2 weeks, right? And then having severe itching in the body, especially around the neck. These are the symptoms you may want to watch for, or even swelling in your arms and legs. These are the symptoms you may want to watch for. And if these symptoms are not going away, you want to get see a neurologist, all right? And also with functional medicine and homeopathy, the sooner you get treated with functional medicine and homeopathy, we can help slow down this progression of this progressive neurological disorder, and help maintain the function, and help people not to lose function.
Okay. So in terms of that help that you're speaking to, We recognize that this is a progressive neurological disease, but certain medical techniques can, in fact, slow the progress of it. What would some of those techniques be?
As I said, we have a lot of research in functional medicine, and we have documented studies in homeopathy, where functional medicine and homeopathy has helped us slow down the progression. And if it is a early onset multiple sclerosis, it can be even reversed, so that the patient can live a life which is full of function, be able to bike, be able to walk, be able to do toileting activities, and so it's all about how early the person gets treated with the functional medicine and homeopathy.
Outstanding. So, kind of building on that last point, with so many questions about treatment approaches, why does homeopathy often have success in treating MS patients?
Well, as I said in all of my videos in the past, homeopathy is a immune modulator, and in MS, what's happening is, as I said, the myelin sheath is lost, right? So what is happening is our body's own immune system is going and attacking the myelin sheath of the nerves, and that is what is causing people to end up in having MS. Or think about it, when they do an MRI or a scan, they see these the plaques in the MRI, which says that that is MS. The plaques are basically the loss of the myelin sheath. And what is coming and attacking it? It's the body's own immune system. And as I said before, there are a lot of triggers which can cause it. And all these triggers are actually ending up in causing autoimmunity. And homeopathy as an immune modulator can help the body's immune system to be modulated, so that it is not acting too much. So we have thousands of remedies in homeopathy. It's all about finding the correct remedy which matches the patient's symptoms. And once the correct remedy is given, the patient's immune system doesn't overact.
Okay. With so much uncertainty that's around how people respond, and ultimately, in cases, they persevere with multiple sclerosis, can someone live a normal life with MS?
Yes, again, it all depends upon how early they get treated, how early they get diagnosed. As I said, it's a progressive neurological disorder. If they have been having MS for many months and years, and they haven't been treated with functional medicine and homeopathy, what happens is they could lose the function of walking. They could lose the function of doing transfers, like standing up from a toilet seat. So, and I have seen patients ending up in wheelchair and even needing help with feeding and transferring to the bed onto the wheelchair. So it all depends upon how early their condition is diagnosed. The diagnosis is done by a trained neurologist, and sooner they come and see a certified functional medicine practitioner and a homeopath, we can help patients with MS to maintain their function and prevent losing function.
See. Dr. George, I think it's incredibly admirable that with your background and the ability to combine different disciplines, that you're uniquely situated to be able to help MS patients as they go through this path of healing. On that point, how do people who are suffering from MS reach out to you so that you're able to treat them?
Yes, our office is located in Redlands. Excel Physical Therapy and Wellness. You can reach us at 909-792-5050. And you can also visit our website, excelrehabandwellness.com. You can also search us on Google, Excel Rehab and Wellness, Excel Physical Therapy and Wellness. You can see our 5-star Google reviews. We have treated a lot of patients with chronic health problems and chronic pain issues. And we are looking forward to helping people get them early into treatment so that we can help them maintain their function, what they have, and help regain function, help prevent loss of function. The sooner is better, and our motto is prevention is better than cure.
Indeed, prevention is better than cure. Once again, Dr. George, thank you for sharing your insights, sharing the knowledge, and I think in many of the folks in the Inland Empire who will be looking for you, you're giving them aspiration to have healthier lives. We definitely appreciate that.
Thank you.